Hello, everybody. Today I'm going to talk about traumatic brain injury and its link with dementia. So, traumatic brain injury is an injury that affects how the brain works. It can result from any violent blow or jolt to the head or body. It can result from any other external force as well, such as electrical, mechanical, chemical, thermal, or even radiation force. But the most common force of impact is mechanical force. So one of the initial links that were made by Dr. Martling between dementia and its traumatic brain injury, he noticed that there was a loss of unconsciousness between the people in sports, such as in boxing, and there was a development of cognitive problems later in these people's life, and the problems such as tremors. So this was the link that he made, and about 15 to 20% of the boxers develop some kind of dementia in their life, which is called dementia prelistica. So this assessment, this statistics is based on one of the largest studies that was done in Denmark. It was based on 2.8 million patient cases over 36 years. It was found that a single TBI, traumatic brain injury, is associated with an increase in the risk of dementia by 24%, whereas 4 traumatic brain injuries are associated with an increase in the risk of dementia by 60%. So mild TBI is TBI in which the person loses consciousness for about 30 minutes or less, or maybe there may be memory loss that may last less than 24 hours, whereas in the case it increases when we go from mild to severe. In severe TBI, the person may be unconscious for more than 24 hours and the memory loss may last for more than 7 days. GCS, we are going to talk about GCS later in the slides. It's a diagnosis scale. Some of the signs and symptoms that are associated with TBI-induced dementia may include cognitive symptoms such as problem-solving difficulties, loss of sense of time and space, and varying from this there may also be motor symptoms, motor difficulties such as weakness, paralysis, along with various mood swings, anxiety, depression, and functional difficulties such as bathing, eating problems. There may also be fizziness, there may be dizziness, there may be fatigue, there may be headache. So there's a lot of symptoms and signs which may depend on the type of injury and the time associated with the injury, like what kind of impact it had on the brain. So for diagnosis, there are multiple things that can be done by the healthcare providers. The first are neurochecks. These are questions asked by the healthcare providers, such as how did the injury occur, how did the person lose consciousness, or how long the person was unconscious. Then there is Glasgow scale, which is ranging from 3 to 15. It is based on whether the person can speak normally. Maybe can they open their eyes, or can they move their body. So a person with the GCS of 13 and more is said to be in mild TBI, whereas a person with a score of 8 or less can be said to be in severe type of TBI. Then there is Rancho scale, which is a level 10 scale in which a patient on level 1 may not respond to voice, sound, light, or touch at all, and they may be appears to be in deep sleep, whereas a person on level 10 may do multiple tasks at the same time, but they may get irritable under stress. So then there are standardized tests such as imaging tests, which are done to develop a map of the brain to identify if there are any physical damage that can be identified by this test. Then there is intracranial pressure monitor to monitor if there is an increase in pressure inside the brain. And one of the other assessment scale is JFK Coma scale, which measures hearing, vision, movement, and communication to arousal in patients in coma or minimal unconsciousness state. So there may be difficulties with the patients with respect to social interaction. There may be having difficulties with making friends, with keeping friends. They may also have financial difficulties due to them being, they may have to move to less well-paid jobs. They have to reduce their employment hours, so they may have to give up their employment altogether. There may be extra costs associated with such as medical or rehabilitation needs. There may be, so we have also talked about the signs and symptoms. There may be difficulties similar to those symptoms, such as difficulties with active daily living, such as bathing, eating, and getting dressed. There may be difficulties like that. There may be emotional and behavioral difficulties as well, such as depression, and they may have to experience such mood swing or disorders. There are personality changes that may happen with these patients. So it is also important for caregivers to seek support, because they may have to experience anxiety, stress associated as well. They may have to seek personal care assistance. They may have to seek support of brain injury groups. They may have to seek support of short-term counseling as well. Sometimes they may the partner that are involved may also have to be believed to be felt like they're married to a stranger, because of the changes of in behaviors and changes in traits that are associated with patients. There may be changes. They may have to be dealing with changes in responsibilities as well, and roles as well. Changing one of the like roles, such as how managing household finances and uh, different things like managing their children's daycare. They may have to they may have to change these roles. Uh, so there may be a stress associated as well in this case. So some of the tips that can be utilized to manage the stress, maybe saying thank you to each other. They may be taking breaks. They may not be as long breaks, but they may help. So these kind of things may lead to changes in intimacy as well. There may be less communication, which may result in feeling alone, or uh, feeling sad as well. So the partner may have to manage their patient's relationship with the other family members as well. So the partners may also feel like they're kind of neglecting their children's needs as well, because of the extra kind of work they have to do. So all of these kind of things interplay between each other, and yes, there is kind of a lot of problems and difficulties that caregivers also have to face along with patients. So these are the sources that I identified. One of this is this brain injury information handbook provides information to patient and family to navigate them through post-injury experience. This is published by Shuri Center. Brain Injury Canada Connect provides helps connect with the organization and services related to brain injury, such as case management, advocacy groups, psychological services, etc. OBIA, this is for Ontarians living in these are basically for people living in Ontario, and these provides things and provides education. They provide awareness. They provide support as well. The Compassionate Justice Fund is for people who have acquired their injury through intimate partner violence, abuse, or unstable housing or homelessness. These help people get financial access of about $500 to $1,000 to pay for their therapies, such as music therapy, natural therapy, pathic therapy, and such as they may also help they may also apply for a rehabilitation support worker to help fill out forms, help you to learn and use technology, or carry out a rehab program, which is developed by a registered healthcare provider. So these are the resources are found related to uh, uh, around GTA, because I live in Brandon currently. Brain Injury Association of Pete Halton is situated in Mississauga. There are several programs such as adult and youth activity groups, as well as peer mentoring programs. Brain Injury Society of Toronto have case coordination services. They organize workshops and weekly services programs as well. Then there is Toronto ABI network, which helps connect with hospitals and community-based program with patients, and they manage they manage about 900 referrals in a year. And then there is Mind Forward Brain Injury Services. They also provide case management. This is situated in Brampton. They provide case management, clinical services, day programs, and residential living programs as well. Then there is West Park Healthcare Center, which provides ABI adult day programs, which offers recreational activities, social support, skills training, and case management. So the support is also provided to caregivers in this program, including education on managing ongoing behaviors and a respite bed for overnight client stays. And these are the references that I researched during my preparing this presentation. And thank you so much.